Good morning all. I am Dr. PJ and Madam Rafi. Today we are going to discuss about cephalosporins and their uses, okay, and their classification also. So obviously first cephalosporin is a beta-lactam antibiotic, okay. So beta-lactam means it consists of beta-lactam ring. Among with this beta-lactam ring, it has 7 amino cephalosporinic acid nucleus, okay. Next is cephalosporins will have 5 generations of drugs, okay. First we have to remember the names, okay. So first we will see the first generation. It will be cephalexin, cefazolin, cefatril, ceftradine, cefadroxil, okay. Second generation will be cefaclar, cefuroxime, cefotitan, cefoxetine. Third generation will be ceftriaxone, ceftazidime, cefoperazone, cefixime, cefataxime. Fourth generation cefepime, cefpirom. Fifth is ceftabiprole, ceftaroline, okay. Among these 5 generations, we have to remember the names, but it is difficult to remember all those names. So we have small mnemonics to remember these generations. If you see first generation, all start with CEF only, CEF only. If it is consisting of, if a drug is consisting of CEF, after that it will be A starting, means it will be first generation, except one drug, that is cefaclor. It is in second generation, okay. It's mnemonic only, we have to remember because they are asking drug names also, okay. That's why if it's starting with CEF, after that A starting means it is first generation, okay. If the name consisting of one or me in the ending, that is ONE or me in the ending, that means ceftriaxone, cefoperazone, okay. If you see here, ceftazidime, cefixime, cefodoxime, all these things end with one or me, okay. That are third generation. If the name consisting of pi in the name, that is cefepime, cefpirom, both consisting of pi in the name, that is fourth generation. If the name consisting of rol in the name, okay, that is fifth generation. Ceftabiprole, ceftaroline, both consisting of rol in their name, okay. So this is how easily you can remember. First generation A will be there, third generation one or me, fourth generation pi, fifth generation rol, okay. So except will be second generation only. In second generation, exception will be cefaclor. It is a, if consisting of CEF, but A also there. Cefaclor. Next one will be cefuroxime. If you see me, it doesn't goes to third generation. It is in the second generation. That's how you can remember. Okay. Next will be spectrums of this generation. First generation is effective for gram positive cocci. Second generation is effective for gram negative bacilli. Third generation is effective for gram positive cocci, gram negative bacilli, that is pseudomonas. Next, anaerobis bacteria. Fourth generation, it will be same as third generation, and it is also effective for some methicillin resistant staph aureus. Okay. Next, fifth generation is, it is effective against MIRSA, that is methicillin resistant staph aureus, and pseudomonas infections too. Okay. So in that one, we have to remember the drugs name in the generations. Okay. So that I explained, right? Those mnemonics easily you can remember. You can crack that MCQ. Okay. Next. Next, coming to the pharmacokinetic properties of cephalosporins. Obviously, these are beta-lactams, so they are also excreted to the kidney. So obviously, in that also most cephalosporins are excreted to the kidney through tubular secretion only. Okay, except ceftriaxone and cefoperazone, they are excreted to the bile. This is an MCQ. Okay, ceftriaxone and cefoperazone, both are very important drugs. Both belongs to which group? Third generation. Okay, so they are excreted to the bile. So next, uses of cephalosporins. Drug of choice for surgical prophylaxis is cefazolin. Okay, it is a first generation drug. Next, effective against pseudomonas will be ceftazidime. Okay, that is third generation. Cefoperazone, third generation. Okay, among these two, ceftazidime has maximum effective. Next, ceftriaxone. This is the most common drug, one most common MCQ repeatedly asked regarding ceftriaxone. Okay, and cephalosporins. Ceftriaxone is drug of choice for gonorrhea and salmonellosis, that is typhoid condition. Okay, but it is not effective against MRSA, that is methicillin resistant staph aureus, Listeria monocytogenesis, and Enterococcus faecalis. Okay, these things it is not effective. Next is adverse effects of cephalosporins. Obviously, these are also obtained from microbacteria, so it is hypersensitive. Next is hypoprothambinemia. Hypoprothambinemia. This is an MCQ, very important. Drugs in cephalosporin group causes hypoprothambinemia means cefoperazone, cefotitan, cefamandole. Okay, this is the order. Cefoperazone mostly causes. Okay, this is an MCQ. Recently also they asked in AIMS. Okay, drugs causing hypoproteinemia in cephalosporins is cefpoarizone, cefotitan, cefamendol. Okay, next biliary sludging syndrome will cause by ceftriaxone. Next neutropenia will be ceftazidime. Next disulfiram reaction will be caused along if you are giving in along with alcohol. These drugs will cause disulfiram reactions also. Okay, that's all. This is a very important in cephalosporins. We have to remember the drug of choice and the side effects in cephalosporins. Okay, that's all. Thank you.